we use something called an advanced medical scan that uses electrical frequencies to scan the brain, scan the immune system, the gut for toxins, inflammation, infections, trauma, all these underlying conditions that can contribute to pain, looking at what's going on with nerves and is there demyelination that's causing pain? Is it a central pain? Is it peripheral pain? All these different issues that have shown up in the hundreds of patients that we've scanned. That is just mind blowing that these patients have struggled for decades with this chronic pain. I'm just blown away by their ability to persevere and push through despite having bladder pain that feels like razor blades every time they pee, or chronic brain headaches, migraines because they have a brain infection. It's just amazing, the courage of these patients.
So what does it actually look like, the testing?
So
Like,
you have a interface that you put your hand on, and it uses electrical frequencies to send into the body and to read the response back. And so we can scan not only for underlying pain chemicals like substance P or, interleukin or whatever, tumor necrosis factor alpha, these, inflammatory compounds, but also what regions of the body, like the brain, like the gut, like muscles, joints. And this is something that every new patient goes through a 2-hour scan where we're looking at what are these issues that we can detect. And also in the scan, we can test for remedies and treatments that may be effective at relieving it. So it's been a game changer for our chronic pain patients in terms of like finally getting an answer after, over 40 doctors, over a decade of going to treatments. And it's just amazing just how many near miraculous healings of chronic pain patients have experienced.
okay, so the patient comes in, they place their hand on a plate, it's connected up to
Computer.
some, oh, okay, a computer.
And then this runs software that we can then select what we test for. It's not just a canned like system. It's like, okay, we know that this person has multiple, inflammatory compounds that are elevated. All right, what are the causes of that? Is it mold? Is it parasites? Is it Lyme disease? Is it trauma? Or is it long COVID? And then we can also then see what are the other contributors. So it's not just one data point. We look for like a cluster of information that we can then correlate together and integrate together and build a hypothesis as to what's causing the pain.
If this sparks something for you, there's a much deeper conversation in the full episode. You can watch it here on YouTube or on Spotify, or listen on Apple Podcasts. Like, subscribe, and stay connected for more.